What communication challenges do stroke survivors face, and how can speech therapy address these issues?
So, as you all know, stroke, it can actually cause a lot of, or I can say a series of deficits or disorders. So, the two major disorders that we actually see here is the aphasia and dysarthria. Coming to aphasia, so they have problem, again, it's categorized into 7 types, but if you see, they have problem in producing language, right? And coming to dysarthria, it's purely speech complication or an issue wherein your muscles that's required for speech output is weakened. And in few cases, you can also see apraxia of speech. So what apraxia basically means, the person or the patient has trouble in planning and programming the speech output. So for example, you can ask them a question. So here they remember, they know what to actually tell, but or in the verbal output there's an issue, there's no coordination that's happening there. So you can also see cognitive deficits, and in few cases it can co-occur the dysarthria again with a voice problem, it can occur. And lastly, what you actually see in a stroke conditions are you can see swallowing issue, that is also called dysphagia. So again, if you see, it is divided, dysphagia, it's divided into phases. The first one is your oral phase, then is oral preparatory phase, and then is your pharyngeal phase, and then is your esophageal phase. So it can occur in any of these phases.
How does speech therapy address the issues?
So speech therapy, it is a broad spectrum, if you can see. It's not just we work on speech. No, it's not just that. We work on speech, language, voice, and swallowing, right? So it depends. It depends individual to individual also. So one stroke patient, he may just require a language therapy, or in some cases he may just require a speech therapy. Not all stroke survivors will get a swallowing issue. So it's tailor-made, if you can see. So for example, in case a patient has right MCA infarct, basically, so there are chances of him getting language deficits, right? So what we actually focus on is language part. We give him, it could be aphasia. When I say language, it can be aphasia also. So what we do is we give them language therapy, basically aphasia therapy. So again, the aphasia, it's again, I can say there are 7 types. It can be Broca's, Wernicke's, transcortical motor, sensory, and mixed aphasias, conduction, and anomic aphasia. So it's divided that way. And again, as I told, it's tailor-made to each individual.
So, ma'am, how exactly does aphasia impact a person's communications?
So aphasia, it's a broad spectrum again. When you see speech, it's a whole new spectrum, and again, aphasia is just a part of it. So aphasia, again, it's got a lot of categories under it. So as I told, it's of 8 types, right? So starting with the Broca's. In Broca's aphasia, as I told, it depends on the patient also. If the patient comes to us saying that he's got good understanding, but he cannot express, and there's no repetition, there's no naming, that means we can categorize it as Broca's aphasia, wherein his comprehension is good. That is, comprehension basically is understanding. Okay, he can understand whatever you tell him, but when it comes to expressing what he has to tell or answer, there's a deficit with it. Okay, that is about Broca's. When it comes to Wernicke's aphasia, it is the opposite. He's got good expression, he'll talk fluently, but again, there is understanding deficit. He cannot understand, but he can answer. There is a fluent speech in Wernicke's. So let me tell you about a case wherein a female of age, I can say 68 years old, I can tell you she's a very lively person that I've ever met, very confident, very positive. But a rare scenario is that she had a hemorrhagic stroke, which led to a condition, which caused her a condition, that is Guillain-Barré syndrome. It's a very rare type, but it occurs, right? So at first, there's no speech issue that I identified. She's just come to us. She was in the wards. She's an IP patient. I had gone to see her, and then she's good. She's talking fluently also. There was no issue. But the issue that we actually found was her, or the respiratory tract or anything below your laryngeal area was affected, which is unlikely, right? So what happened was she was eating food, and that was a time that I went to see her, and she just choked on the little bit of liquid that she drank. And we were like, okay, this cannot be happening. What could be a reason for this problem? And suddenly she's got that respiratory distress. She's got bradycardia also along with that. What we did, we've done a VFSS, that is your video fluoroscopic swallow study, just to see if there's any swallowing issue. As I told you, the stroke occurred with a syndrome, that is your GB syndrome, okay, a hemorrhagic stroke. So we did the VFSS, and later it was found that she's got pharyngeal phase of dysphagia actually. So the treatment plan that was given to her was basically the strengthening, and I worked with the physiotherapy team, and we used NMES, neuromuscular electric stimulation. We used that on her, and that's how we improved her swallowing.
What techniques can be used in order to to encourage some kind of social interaction and communication as well in stroke survivors?
The stroke survivors, basically, they lack motivation, is what I've personally seen. Okay, for example, it's just not an example, it's an experience. My own grandmother had stroke, and that led to a brain atrophy later. So seeing her, she's again a very confident woman, and always up and about, does all her work. And when she got a stroke, she was completely out. She was not even talking to the family members. We had to literally force her, we had to literally take her out. So when you see all that, so what they mainly deal with is lack of motivation also. Sometimes in few cases they don't want to do anything, right? So how do we inculcate something? What do we do when such is the case? Is that we try to provide them with a supportive treatments, like you involve them in something called a supported conversation for adults with aphasia, that is SCA, wherein you have trained communication partners who they can actually talk to, right? And you've got all these support groups, especially for stroke people itself, wherein each person tells their own story, because every stroke survivor has their own story, right?
What kind of advice would you give to a patient for maintaining their progress outside of therapy sessions?
So it's just not given to the patient, but it's also given to the caregivers as well. Okay. So as you know, in a therapy center, the therapy can just go about, I can say, for 45 to 1 hour, 45 minutes to 1 hour, right? So anything beyond that, the patient is at home along with the people and the family as well, right? So what I would suggest the patient is, and even the family members, is that basically the involvement is required. It's just like how you take care of a small baby at the end of the day. They require that attention, they require that love, right? So what we do is there's a practice that's called conversational practice with caregivers and family, wherein we involve the patient along with the family, and we counsel both of them. So that's how we teach them how do you actually maintain, how do you actually go about whenever you're having a trouble, or to explain yourself. And mainly here the family should play a role. Okay, we ask the family members to show 99% of the involvement. Okay, so this is just not for the stroke survivors, but also any human being, okay, of age above I can say from their adulthood to their geriatric, that population also. I'll tell that it's important to exercise. It's just not for your fitness physically, it's just not for your physical fitness, but it's for your mental well-being also. People lack to understand it at this age, but particularly for stroke survivors, if you tell me, they require a lot of recreational activities, right? Maybe they can go for group therapies, or you have all these newly built technologies. You have something called exer games, right? Wherein it just makes you do exercise along with the game. So all this will actually attract them. And again, they require a lot of motivation, a self-motivation that's actually required. I think that's how they're gonna improve their health and well-being.
How can a multidisciplinary approach improve outcomes for stroke patients?
from a speech therapist point of view, it's just not us who are lending help, but there's always a saying, right? So it takes a effort from a lot of people in case they want to build something up just or create a foundation, right? So again, when it comes to this multidisciplinary team, we actually require the neurologists who are the identifiers, I can tell, of a problem, and then we require physical therapists because they help with the, maybe if they have any sort of balance and everything, those are the ones who will be doing that job, right? And when it comes to us, the speech therapists, we do a different set of things. Maybe it could be speech, it could be voice, it could be swallowing or language as well. So again, it's always a teamwork. Just one person, if you expect them to work and just make it proper, it doesn't happen. Again, there's a respect to all the professionals here, and I can say the neuro team does their work, the physio team does their work, and us, we do our work. We cannot interchange, but rather we can mix around and share the work.